Bring in Dr. David Winter from Baylor Scott White Health this morning. Dr. Winter, I was reminded of mosquito season the hard way earlier this week.
You're talking about the West Nile virus that you just mentioned. Yeah, it's a bad disease. Fortunately, it's not that common, but the cases sometimes can be quite severe. You want to avoid mosquitoes, use the sprays, stay indoors early morning, late evening. That's when mosquitoes are most active.
Another thing that crept up on us, Dr. Winter, this summer heat. I know we've talked about it before now, and earlier this week on Daybreak, I reminded folks about the importance of sunscreen. We are, of course, in the middle of Skin Cancer Awareness Month. Also, there are tons of outdoor events this weekend, so we really do need to be aware of heat-related illnesses.
Yeah, heat-related illnesses are most common in the frail, the elderly, but also in young athletes. You need to know what the risk factors are. Of course, high temperatures like we're seeing now in Texas. High humidity makes it worse. Strenuous exercise, of course. Excessive clothing that doesn't allow your skin to breathe. Alcohol consumption does not help your body to cope with it. And of course, you need to stay hydrated. Now, early symptoms you need to be aware of. So you'll see headaches, dizziness, weakness, fatigue, heavy sweating, decreased urine output. If you have these symptoms, you need to get somewhere that's cool and drink lots of water. The next step, if you get this, is confusion, a lot of sleepiness, lethargy, and a high fever. If you get those symptoms, you must contact medical attention right away. That can be really serious.
Dr. Winter, turning to COVID now, I do feel like I'm starting to hear about more COVID cases just around me, people I know anecdotally. Where do we stand in North Texas and also across the country at this point?
Yeah, they continue to go up, Sonia. Still not as bad as earlier in the pandemic, but we're seeing steady increases for the past 3 weeks. And we know these are probably underreported because the most common way to get a test these days are at home, and those aren't tabulated, of course. So be aware that it's out there, it's going up. And actually, we just saw this week an increase in deaths. So that's a problem. Still not a lot, but it's a slight increase. So understand also that we know that the vaccines do work. Less serious illness, less deaths with those, and a new category has come up. We've seen now folks that have had the total vaccines, either 2 of Moderna, 2 of Pfizer, or 1 of J&J, but have not yet got their booster. And some of those folks are breaking through and getting severely ill. So the booster shots do work. If you haven't got one, you might consider that.
And Dr. Winter, we're seeing video on our screens now about paxlovid. So now news is surfacing that some people experience relapse of COVID after taking it. So what's the deal with this?
Yeah, Paxlovid is these pills, 2 together that you take for 5 days, and they amazingly, they said they lower the chance of severe illness by up to 90%. Seem to work very well. We're seeing a few smattering of cases, not very many, where after you finish the 5-day course, then you get a rebound. So not very many of those. So far, no serious illnesses. We're not sure what yet to do with that. Maybe another course, but stay tuned. Official reports on these are not yet out.
Yeah, I guess good to just be aware of. Finally, I know we talked about hydration, but when it comes to caffeine, some reports are suggesting that regular coffee consumption can decrease our risk of heart attacks and strokes, but then other studies say that certain types of coffee can increase cholesterol levels. This is interesting. Explain this one to us.
Yeah, it gets confusing, but studies going back actually a decade or so show that if you drink 1 or 2 cups of coffee, you actually lower your risk of heart disease and may extend your lifespan. You may live longer with that. But new studies say that if it's unfiltered coffee, the coffee you get in espresso or maybe in that French press technique, that increases cholesterol. That's not a good thing. Of course, if you add cream to your coffee, that's not a good thing. And then another study says if you drink a lot of coffee, 5 cups or more, that can stimulate the heart excessively. So I think the bottom line is if you want to drink coffee, it's probably a good idea. Have the filtered coffee, 2 or 3 cups. Of course, everything in moderation. Sonia, back to you.
I'm going to have to take that advice, especially after this week. All right, Dr. Winter, thank you so much. Good to see you.
Thank you. Good to be with you.